Hello, everyone, and welcome to another exciting episode on Serenity TV. I am your host, Goodness Chisholm, and today we'll be diving into a very important topic that deals with children's health, their oral health, and other things attached to oral health. Okay, now what's uh what's oral health all about? Why do parents neglect their children's oral health and then until it worsens to bad breath, mouth odor and the rest when the parents now remembers, oh, my child has a mouth odor, then they rush them to the hospital. Now, dentation is a very delicate part of a child's health, especially when they are tender, right? Okay, now let's talk about this and find out what all these things have to in place for us. Now, joining me to discuss this wonderful episode and talk about children's health would be a medical doctor, a dentist in the field. You understand? So we have Dr. Ugochukwu, who is a dentist. You're welcome, sir.
Oh, thank you very much.
Yes.
Dr. Ibuanyesi Ugochukwu. I'm a dental surgeon in a private setting.
Okay,
Yes,
you're
yeah.
welcome, sir. Now we have Retractor Emmanuel Favor.
Okay, thank you so much. I'm Rotrato Favor Emmanuel Chibuzo.
Okay,
Yeah.
Chibuzo.
Yeah, from the Rotary Club of Awanikoko Federal University of Education, the club secretary.
Okay, and then we have Retractor Ejironye Divine Favor.
Okay, thank you very much. Retractor Ejironye Divine Favor
Okay.
Chibuka of the Rotary Club of Owerri Metropolitan and the Public Image Chair, which has to be also the project chair of the club.
You're welcome.
Thank you very much.
You're welcome. Okay, sir, we would love to know. Can you explain why children dental health is very important? Because many parents tend to ignore it and be like, yeah, it just it.
Well, yes, I agree with you. They ignore it because in my course of practice, I've seen a lot of damages that have been done due to parents' neglect on their child dental health. Now, before you become an adult, we all pass the stage of infancy and child, as we call it. And when you talk about child dental health, it comprises of many things in total. And when do you start? The question is, as a parent, when do you start taking care of your child's health? When do you say, okay, I need to take my child dental health serious? When is that point? And my question is, my answer would be from the very moment you take in. From the very moment you take in.
Oh.
Yeah. As soon as you know you're pregnant, that is the first time you should be conscious of your child's health, because there are a lot of things that happen during development.
Exactly.
You understand that? During the development of a child while in the womb, if a mother make any mistake by taking any kind of a drug that is not approved, it can damage something in the child, and the damage will be seen when that child starts growing. You get, it's not just when the child is out. So immediately a lady finds out she has taken in, she needs to be extremely careful with what she takes in. Now, once that child successfully comes to the world, when do you now start doing the physical care? As soon as you see the first set of teeth in the mouth.
Those little dragons.
Immediately you see those set of teeth in the mouth. That should be the time you start taking care of those teeth. Clean them as often as possible. You get, monitor them, monitor the shape, keep monitoring it. As your child keep growing and the teeth comes out, keep monitoring these teeth. Know when the milk teeth is failing to fall, because you see a lot of people with scattered teeth, zigzag teeth. When I see them, I just laugh. I say, your parents didn't do you any good, because there was a time the milk teeth is supposed to fall off to be replaced by the permanent, But the parents will leave them there. Before you know, the child will have like 7 teeth all crowded up together. But the beautiful thing about it, some parents are becoming more aware. They bring their children because the belief is that all milk teeth should fall by themselves. And it's a erroneous belief.
Okay, sir, please, a question there. Is there a particular time for the milk teeth to
Yes.
follow?
Yes. It's a range, not a particular time.
Okay,
It's a range.
Okay.
Yeah. Between the age, we call some people early erupter.
Okay.
Now, some child, you start seeing them erupting teeth from 4 months. So we give, it's usually 6 months, but we give plus or minus 2 months. That's 6 to 8, that's 4 to 8 months for those teeth to start coming up, for the milk teeth to start coming up. Then, when you start having your permanent teeth, the milk teeth are supposed to fall, and that is from the age of 5. Some people as early as 4.5, like 4 years and 6 months, they start having their permanent teeth. We call those people early erupters.
Okay.
You get, and we have late erupters that are even as old as 7, their milk teeth have not fallen. But it's not all milk teeth that falls on their own. So once those milk teeth refuse to fall and you start seeing other permanent teeth coming out, we usually advise the parent, bring them to the clinic so that the dentist can assist in bringing them out. If not, you end up making that child have crooked teeth, crowded teeth. You get. Now that's for eruption and but there are other things. Mainly, we see this with parents that love their child so much, they don't want the child to cry. Before you know, they put pacifier into the child's mouth.
Yeah.
As soon as that baby start having teeth, stop using the pacifier. Because the pacifier will cause delay in growth of the tooth. Before you know, the front teeth won't be touching each other. The person will now have what we call open bites.
Okay.
The person won't be able to bite with the front teeth because the pacifier will take that space. You get? So you're not supposed to use that. You get? Then another thing, oh, she's crying, give her something to drink, give her milk. Oh, come and suck breast. You put the child sleep with the breast in his mouth. All night, food in the mouth. You're just doing that child great disservice.
Okay, sir. Okay, thank you very much, sir. Now, what daily habits do parents put in place that make them neglect their children's dental health? If you have anything to add, you can.
Okay. You asked the question, so I would love you answer that.
Okay.
Well, I would want you people to see because there are lots of things. See, in our environment, parents are so busy. They are looking for money.
Yeah.
They are looking for money. They don't have that time to start looking into their child's state. You get? So because of that, some of them get to find out late that their child has these issues. You get? So I don't know. I know for me, when I was growing up, my mom was so busy. I never went to a dentist, even if I'm a dentist now. They never took me to a dentist, so I know they were all busy. So that's one of the major reasons why parents don't really have time to look into their children's mouth.
Okay. Now I would like to ask you, Rotaract, what's the name again? Ejiro. Thank you. Now, what brushing techniques do you think parents should have, or should they always supervise their children when they brush their teeth?
I think based on the fact of these dental aspects is a very sensitive issue, they should always advise the children or actually guide them in making use of a particular set of toothbrush. For instance, I don't see it fit or actually nice for a little kid to use just like this local, what do you call it,
Chewing
local
stick.
chewing stick, yes. Because that's not the time yet. And they should actually look into some toothbrush, some toothpaste that will actually clean the teeth at that
Milky Way.
early
Yeah.
age. Because making use of some materials for the teeth at that tender age, it might actually go a wrong way and even adding more issues to the teeth, and actually a guardian to them, because when we were little, actually most of us didn't even know the particular way or manner which we should do the needful to our teeth. So parents will as well guide their children, not the one of they would actually leave their children to actually do it on their own based on they will say you're old enough, you're grown enough. Things like that are also advisable for parents.
Okay.
Okay, yeah,
Okay.
doctor, I wanted to ask, are there genetic factors that affect the child's dental issues?
Well, when we talk of genetic factors, there are a lot of genetic factors that affect, like cherubism. Those are technical terms. You get. Let's leave it simple so that those listening will understand. Common things happen commonly.
Okay.
The genetic ones are not as common as the basic oral hygiene you're
Okay.
supposed to do. You get. So I usually advise people, look into your child's mouth. It's as simple. Open that child's mouth and look inside. That alone will save that child a lot, because the child may not be able to express themselves the way adults expresses themselves.
Yeah.
But when you open the child mouth and you look inside the child mouth, you see things that are not supposed to be there. And when you see them early, take them to the dentist. You get. And children also learn by what we call tell, show, do. Tell, show, do. You get. It's like a modeling technique. You tell them, you show them, and you do it. So they will learn after you. So when you develop the habit of brushing in front of your child in the night, they follow suit. You get. So you don't tell them, go and brush your teeth. They won't do it. You have to brush your teeth in the night for them to brush. In vertical strokes, not horizontal stroke. Vertical strokes. You get.
Okay, so what are the common deficiencies that are seen in children's oral health nowadays? And is the lack of calcium and other necessary things causes of this?
Well, not necessarily calcium. You get. Not necessarily calcium. When you say deficiencies, it just have to do with the kind of food you eat. You get. But for you to have good oral hygiene, you don't need to have a deficiency in anything. All you just need to do is, one, reduce the amount of leftover food in your mouth. Are you understanding? It's as simple as that. What damages the tooth is the actions of the bacteria in the mouth feeding on leftover foods. Now, irrespective of the type of teeth you have, there should not be leftover food in your mouth. There should not. I was saying something earlier. Parents that love their child so much, letting the baby sleep with the breast in the mouth. That's like using machine gun to finish your child's teeth. You get, or giving them bread to sleep with.
Wow.
You get, you see a child is crying, you give them bread, they'll eat the bread and sleep. Or you're just damaging that child's teeth. We don't need leftover meals in the mouth. It's as simple as that. Brush at night. After brushing, don't eat any other thing. As simple as that. And I won't see a lot of children. Just do that and you solve a lot of problems for the child.
Okay, so you've answered the question concerning the calcium doesn't really cause some of lack of calcium doesn't necessarily cause some of these
not necessarily lack of calcium, because you need balanced diet.
Okay, you need a balanced diet.
But even if you have the balanced diet and you have remnant food in your mouth, the damage will be done.
Okay.
Do you get what I'm trying to say?
Yes.
It's not necessarily deficiency. Just avoid remnant food.
So there are no known deficiencies. There is not no deficiency.
There are lots of deficiencies that could cause issues.
Okay.
You get
Yeah.
scurvy for one.
Okay.
You get then deficiency of vitamin D deficiency. You get, but that is not the primary thing when you're talking about how to take care of a child's mouth.
All right.
The primary thing is good oral hygiene.
Okay.
All right. All right, viewers. Let's go on a short break. I will be back shortly. Stay tuned. Hello, viewers, and welcome back. I'm still in the studio with Dr. Uguchukwu and retractor Divine Favor. Yes, I'm sorry, Emmanuel Favor. And the retractor Divine Favor. Yeah. So we are still discussing children's dental health, right? The deficiencies and the solution. Now, let's bring it down. We have been serious all along. Let's calm down now. How many times do you brush your teeth daily?
Okay, to be honest.
Okay.
Okay, I think that was when I was little. My mom used to brush our teeth twice a day. But as I grew up, I think it's stressful.
Oh, why?
Honestly speaking, I think it's stressful.
Oh.
So, even if God touches my mind, I can brush twice a day.
So what do you have to say about that?
Well, I'm a dentist. Even me, I'm not religious. Let's be honest. Sometimes you just come back after after going out to eat with the guys. You're tired. You have your bath. You forget to say your toothbrush. You don't brush out. You
After
move.
it is
So sometimes it's. But we encourage. You say we encourage people to do it, but we know sometimes it's not 100% feasible. But we say try do one.
Okay, try and brush your teeth.
Yes.
So how about you, sir? Do you brush your teeth twice a day?
Actually, just like my colleague said, it's when it pleases the heart, like when it touches the Lord. Yeah. Most times, we wake up in the morning, we brush before going to school, lectures and other things. But you come back, feel like the one you did in the
Some
morning.
persons
Why
forget
do
to
you
brush their
believe
teeth
that? Do
in
you
the
think
morning.
it's stressful?
You just looking
Or is
like
it that
it's a
you're
normal
trying
routine.
to economize your toothpaste?
Exactly.
Well, I think it's habit. This part of the world, we're not there used to have.
Yes.
We're not there used to have this part of the world. So I think it's all about habits. Some persons have developed the habit over time. Starting something you're not used to when you were
very
young,
difficult,
it's quite stressful. You have to consciously learn to do it. So I think that's the case.
And just like when we were growing, before we go to the school, they brush our teeth. And when we come back, they don't brush our teeth.
That's
So
it.
you give
So
a
we
no.
feel like
That's
it's just the normal standard.
Yeah.
I've grown with such habits. That's it.
Okay. So there is this superstition and belief that the milk teeth, the milk teeth is not important. That's why parents neglect it. Do you think the milk teeth, like you said earlier, parents are supposed to take note of their children's oral health, even from when the child is in the womb, right?
Okay.
But the belief, like I said, the superstitious belief is that it is not important then, but this milk teeth is not also important too.
That you see, it's not important. Is a very erroneous belief because the milk teeth are actually guidance teeth. We call them guidance teeth because they guide the permanent teeth into their rightful position.
Okay.
You get, and for a child for 4 years, that's the teeth the child is using to do everything, and you're saying it's not important. You get, and it can go bad. And do you know pain is pain? There's no big pain and small pain. You ignore that tooth, the child will be living in perpetual pain for 4 years. And you say it's not important because it will fall, so the child should be in pain. That's wrong. It's a very important. Every part of your body is important. The way you take care of it matters a lot. So that belief will keep correcting people one day at a time. With time, we'll get to that point where everybody knows that.
Sir, in the first session, you made mention of parents should open their children's mouth and look into that. Because while I was growing up, I think that should be when I was in primary school. I noticed that two of my teeth were wobbling.
Okay.
Then and that morning you're having a akara and a pap for breakfast. And then as at the process of eating the food, the teeth forcefully pushed two of the teeth and I swallowed them.
Really?
And when I showed my mom was like, go and wash your mouth and can't continue eating. And there was no and the whole fear was that the teeth would grow in my tummy.
Yes.
So why is that? Why is it always that superstitious belief to make the children always scared of their teeth falling off, something like that?
Well, as you said, it's superstitious belief, but why I say parents should open your child's mouth is that sometimes the child don't know how to express themselves.
Okay.
You will be the one to find out yourself. You'll be the one to know that this thing is in a wrong position. This is not how it's supposed to be. But if you don't look into that child's mouth, you won't know. You get so look into the mouth. Open that child's mouth. Look inside. You get you bring a child to the clinic. I open the child's mouth and I'm seeing all sorts of nonsense inside, and you're saying it just started yesterday. This did not start yesterday. This thing started years ago. You just ignored it. You get so we very soon we all will be parents. We are no longer children. At this is a wake up call. What our parents couldn't do, we should
do them.
We should do them. That's just it.
Okay.
As regards to that milk teeth that we're talking about, I was thinking like he's kind of a waymaker, because just like you said, it's not important. I was even thinking it's something like the first stage before the normal one, but I'm coming to realize that there are some importance of that milk teeth you're talking about.
The milk teeth is super important for feeding that early stage. Are you understanding?
Okay.
For feeding, and also is a guidance tooth. We don't like it falling off. Now, we have pure milk period, we have mixed dentition, and we have permanent dentition. Now, some of these milk teeth will be in the mouth for 13 years.
Wow.
Are you understanding?
Yeah.
Now, if you take that tooth out because you didn't take care of it when the child is 5, the teeth is supposed to guide into position.
Okay.
We may come out in the wrong position. That's why you need to protect it so that it will stay there till the right time it's supposed to.
Okay, that's why some persons have scattered teeth.
Yes. Yes. We call the milk teeth guidance tooth. They guide the permanent teeth into the right position. You get? So you don't need to neglect it. You get? If you neglect it, we will collect your money as dentists. You understand? Because we will now do the right thing for you and you will pay us. You get? That's just it.
And you guys are still praying for more customers.
No. It's not about praying for more customers. It's about you have a problem.
Yeah.
I have the solution.
Yes.
You get? So if you don't want me to collect your money, then do what I'm saying you should do. But if you don't do it, I'll collect your money. That's just it.
Please, I want to ask you, where did you bury your milk teeth?
Most of them.
Yes,
most of them I could remember.
Where is your milk teeth right now? Because I can remember when I was little, right? My mom would tell you, when your teeth falls up, throw it in the roof.
It around the way.
Outside the country, there is this thing that they say that put it under
Tooth
your
fairy.
pillow. The tooth fairy.
Tooth fairy.
So where is your teeth?
Like I grew up in Plateau State, just so I could remember that 5 of them should be on top of our zinc. And at least like 2, like these ones are the ones I could remember. 2 should be at our gate also. Because then they were like giving us a kind of belief that if you put it on the zinc, you have like a beautiful like this and that, like a nice teeth. Then the one I kept at the gate, why I kept that one at the gate there? Because they told me then at that little age that it will bring more good things to my teeth.
Hallelujah.
Yes. So it's like an entrance to
open door,
open door. So that's why I could remember I kept 2 there. So others I don't know.
Has it brought a good thing so far? So good.
Where are you now?
Yeah. Anyway, God is doing his best.
Amen. So what happens to those set of teeth that we chew on the zinc and the...
They've gone to dust. You've returned
Okay,
from
they will
dust.
turn
You
to
came
dust.
from dust. They've gone back to dust. Right? They've gone back to where they came from.
Okay. All right.
I agree.
Okay. So now we've touched more of children's dental
Yeah,
health,
yeah, yeah.
right? You agree with me?
Yeah.
But now, still, though, parents will still come back to parents and what they should do. What is the medical? What is hospitals or dental how will I say
Clinic,
this? Yes.
dental.
What are they doing to enlighten parents, to come to the hospital?
And check the children.
Yes, take your child to the hospital. Look at your child's teeth. Like his main mention here. Open your child's mouth
and look into it.
How many parents do that? Now, even how many parents brushes their child's teeth?
Twice a day.
I think it's only when the baby is still tender that they can use piece of cloth to wipe their
That's
gum,
it.
right?
Okay, like I remember when you said in this part of the world, they don't see it as a norm
Mm-hmm.
to actually brush twice a day.
Yes, they don't see it
So
as a
it's
norm.
mostly abroad that you see them. If they even brush before eating, yeah, who brushes it for you? Nobody does that.
So what's the
Well,
what are the hospitals doing about this?
the dental people, my people, we do a lot to encourage people. Every March 20 is World Oral Health Day.
Yeah.
So we do a lot of this. I know I've been to other stations to give mass talk on World Oral Care. You get, and when I was in school, we do what we call community dental health education, CODE, where we go to schools, we go to markets, we go to different places to do free dental checkup. And even now, we still go to villages for outreach to do dental checkup. And dentistry is broader than just the mouth.
Yeah.
We do surgeries. We do some, apart from the extraction. There's what they call cleft lip and palate.
Okay.
We do that. They do that. There are a lot of things they do. Then, personally, for me, I don't just treat my patients. I manage my patients. What do I do? For every patient I see, before I even tell you, go and pay me, I take my time to educate you. Because it's not just you coming to receive treatment. No. Your knowledge about what brought you, your knowledge about what brought you should be better when you're leaving the clinic. You shouldn't have the same knowledge you have when you step into the clinic.
Exactly.
So I take my time to educate my patients for them to have the basic knowledge of dentistry. You get, and that will go a long way. When they see other patients, they'll tell there are a lot of mites around flying. When you remove one teeth, you keep removing. I take my time to educate. So one patient at a time, before you know, we educate the whole world.
Okay.
And I even think that should be more of the reasons why we have deficiencies in disease, because I believe that most persons, most mothers, most families, most parents, they don't even know about all these things we're talking about. They're not educated, they're not enlightened. So you won't, for instance, me as a person, I don't know about all this we've been saying. And you won't expect me to do the right thing. Just like the one you said, the horizontal and the vertical. If I don't have the knowledge, I won't actually know the right pattern to go.
Yes, sir, please.
So
what is the right pattern to brush teeth?
As we usually advise everybody to brush vertically.
Why are you laughing? You're laughing.
Because doing this cause more damage to your teeth. And we usually advise, please, for no reason should you use hard brush.
Okay.
No use them. You'll be brushing upstairs, those downstairs will be here. For what now? The things you're trying to remove are soft. You don't need it. I usually liken it to you using iron sponge to bath. Using iron sponge, you use iron.
Actually.
You get, that's it. Just use your medium or your soft toothbrush vertically.
Okay, Favor. This is for you.
Okay.
I want to ask you.
Okay.
Let me know. When you chew gum, bubble gum, what harm do you think it does to your teeth? Okay, first, why do you chew gum?
Okay, I'm a student. Let me put it like that first. I love chewing gum because it keeps my mouth busy. Sometimes when I'm not talking, I can ask them, I love talking.
Okay. Do you think it's harming your teeth?
It does, but if you balance it very well,
Why you
balance
balancing
it very.
it?
You don't do it all the time.
Okay.
You don't do it all the time. But I prefer chewing when I'm reading and when I'm not talking.
When you're not talking.
Yes.
So what harmful effects does chewing gum have on the teeth?
Now, it will shock you if I say that chewing gum is beneficial when you chew sugar-free gum.
Thank you,
Okay,
sir.
sugar-free gum.
Yeah.
Okay.
Because it stimulates flow of saliva.
Like
in the
fluorides?
mouth. No, fluoride free. Like
Okay.
I don't need to advertise for anybody. I don't need to advertise when they come pay me. You understand? Just sugar-free gum. It helps increase the flow of saliva in your mouth, and once the flow of saliva increases in your mouth, it reduces the accumulation of bacteria in your mouth. So it helps too. There are some of our patients we tell after some particular kind of surgery, say please go buy gum. Make sure you chew gum to make your mouth open. You get it. Also exercise the jaw.
The gum. Okay,
Yeah,
the
it
jaw.
helps the jaw too. But as long as it is sugar free, because we don't want you to have constant sugar load in the mouth.
Okay.
You get it should be sugar free. It helps.
Now you've learnt one. Will you still pick up sweet
Because
again?
they told me that it will make the teeth to be weak.
What about
Well,
sweet?
I remember very well in secondary school that they told me that if you continually chew gum, it reduces the microorganisms in your mouth.
Yeah.
I'm correct, right?
Yeah.
Thank you.
Okay.
But sweet, no, is sticky.
Okay.
And we don't want anything sticky in the
your
mouth because it
mouth,
serves as reservoir for foods for the bacteria in your mouth to feed on.
Okay. Wonderful. So, what about you? Do you believe in the era of chewing gum, or just let's go with the flow?
Me actually, I would say I chew gum for pleasure.
I look
For
at you.
pleasure.
Yeah, because actually
I'm smiling.
I skate and I actually chew it to keep myself busy. Just like when I'm skating, I'm always with my AirPod and my earpiece. So I feel like it's something that gives me more energy. Even like she said, whenever I'm reading, in terms of my reading time, like I feel like the gum will keep me active. But I'm now realizing that there are a lot of benefits and effects attached to it. So minimize and maximize also.
We'll
Mm.
reduce and still increase some
In the
levels of
sugar-free way.
Yeah, sugar-free way. Yeah.
Okay, sir, before we round up, right, there are some parents who can't afford them to visit to the clinic. What advice do you have for them to like check in? Like you mentioned earlier, always open your child's mouth to check, right? But then what other things can they do apart from that?
Now, I would not want to say they can't afford to go to a dental clinic.
Okay.
I would rather advise that they pick one day in a year to go to it for dental checkup.
Okay.
Very, very important because they are like it's very. How would I put it? There are many things you won't know that you think is normal. That when you make yourself, when you present yourself to a dentist, they pick these things early. We usually say signs and symptoms. Patient presents with symptoms while the doctor sees the sign. You get. So when you present early, we see the early signs that will save you costs. You get. You don't wait for symptom. When you wait for symptom, you end up spending more.
Okay. Thank you very much, sir.
You're welcome.
I think I need to visit this thing. I can't remember the last time I went from.
I don't think I've ever gone.
You ever? Because I don't think I've ever gone. Okay, so get friends, you all have seen it. It has been a very wonderful time in the studio with Dr. Ugochukwu, right? Retractor Divine Favor and Retractor Emmanuel Favor.
Yeah. You can call me Fabiema.
Eh?
Fabiema.
Oh, okay. Thank you. All right, guys. Till next time, just remember Serenity TV.
Yeah.
Stay tuned.